Hi guys, let's talk about how to get into medical school here in the Caribbean or medical school pretty much anywhere in the world. So, for the most part, to get into medical school, your curriculum vitae has to be very extensive. Some schools are more competitive than the others. Here in the Caribbean, your extracurricular activities count for a lot in the sense that if you do sports, if you're involved in clubs at schools, extracurricular activities could be like representing the country, whether it be at Carifta, which is a regional games um, that a lot of the islands in the Caribbean compete in. Whether it be if you're an Olympian, you name it, it counts. So my medical school career started from as early as first form. We do first form at about 11, 10 to 11, 10, 11 years old. I went into first form at 11 years old. And from there, straight through to about fifth form. When you're about 16 years old, you make a decision in the third form whether you want to do sciences, arts, whether you want to do more technical stuff that takes you towards engineering. So in my third form, at my school, which is Harrison College, I chose to do sciences, which is biology, chemistry, and math, physics. I wanted to do those subjects at CXC, so you choose them from third form and you go straight to fourth form. So from fourth form, I did 8 subjects, and these 8 subjects were chemistry, physics, biology, maths, English language, English literature, geography, and Spanish. Those are the 8 subjects I chose. My school, you had to do a language and you had to do a science. And English language and English literature, as well as maths, were compulsory. So those those are already chosen for you. So whether you want to do all 3 sciences, that was the next step. And I always knew I wanted to do to do medicine, so I had no other options really. As the truth, it was from the time I knew myself. I knew I wanted to be a doctor. Initially, I wanted to be an oncologist. I kind of lost my way in terms of oncology because I realized that I like to do surgery. So from fifth form, I did CXC maths, the subject I just called, and I did them at CXC, which is an equivalent to that would be like GCE or O levels, which is what the UK does. Um, I didn't do so well at least as well as I thought I would do. I got 3 1s. I think it was 3 1s, 4 2s, and a three. A three was in Spanish, which is considered like a pass, but not an amazing pass. And a one is considered an A. So let's just call it A. So 3 A's, 4 B's, and a C. I wasn't really too happy about that. After fifth form, I got accepted back into school to do CXC, well, to do CAPE or advanced level. Oh, by the way, I also did advanced maths, which I got a C in as well. Advanced maths is like just below A level. So when I got into sixth form, I chose biology, chemistry, and maths. The reason I chose those subjects, I wasn't really too certain I could handle physics, even though physics and maths are like hand in hand. So I did that. And in my first year, on my first unit of CAPE or A level, I got 3 2s and a 4. A 4 is a pass. Anything after 4 is a fail. So technically, I got 3 B's and a C. Call it a C. But I knew those grades weren't going to get me into medical school. So I was promoted to upper six, and while in upper six, I decided I would take back over my initial units, which should have been my the units I did in my lower 6 year. So I took back over everything, and when I graduated, I got 5 1s and 3 2s, which is the equivalent of 5 A's and 3 B's. During that time, I had applied to University of the West Indies Mona campus. However, I wasn't successful in my first year of um, application to the Mona campus. So I had to wait out a year, and I did a very rough year of what we would call biology, chemistry, or we would call N1. And I did this N1 year, but it was just so stressful. And I think I was a little depressed at that point in time too. So I did really poorly, but I applied using my CAPE grades and to medical school in Trinidad instead. By this time, I just said, okay, let me just go to Trinidad instead. I applied and I was successful, and I went to medical school in Trinidad. Um, in my medical school in Trinidad, it was different from the medical school here in Jamaica. Jamaica's medical school is structured differently. They actually go and do clinicals for a lot earlier than we do in Trinidad. And yes, it has its benefits, but at the same time, we all set the same final exam. They're different campuses, but they're all the same final exam. They all do the final exam. This is the same. So I did that during my rotations of surgery. I had a very rough surgery rotation in fifth, my fourth year, and I'll tell you, there was a particular consultant that even at that point in time when I was in Trinidad told me I would never amount to anything. Told me essentially that I'll never graduate, and I had rough rotations in internal medicine. But I even remember one time when I was in medical school going to a bathroom and literally crying. Like I really wanted to just leave and go back to my country because I felt as though it wasn't worth it. Like why was I allowing myself to be humiliated by these people? At the same time, as I got older, a little bit wiser, I realized life's not supposed to be easy. And when you have a great mother like mine, my mom was like, stay in school, settle yourself, and you can do it. And thank goodness, thank God, I was able to compose myself and remain in school. So my medical school career was not easy. It was tumultuous. I literally, I think, from first to third year, I was able to pass everything without failing it, which would be my preclinical years. From my in my fourth year, I failed my internal medicine rotation. Had to repeat that twice. I failed my PEDS written exam, but passed the PEDS OSCE, so I had to do remedial work for that. In my fifth year, I failed. No, my fourth year I failed ophthalmology. Had to repeat that. And in my fifth year, I failed no, I didn't fail the internal medicine rotation in fifth year, but I had to put in a lot of extra work in my fifth year to make sure I didn't fail. And then I failed gynecology, obstetrics and gynecology, even though I passed the fourth year clerkship. I don't know what was going on in my mind. I failed the fifth year rotation. So I had to do remedial work for that as well too. So I graduated in 2013, and just before my exams, I was in the hospital doing remedial work for obstetrics and gynecology, which was in itself, I was the only person who failed that exam. And it's not easy to do these things, to fail an exam. So anyway, I'm giving you my full story because I want you to understand how this journey is not easy. So from my fifth year, I did the three final exams, which is obstetrics and gynecology, internal medicine, and general surgery, which covers ophthalmology, anesthesia, orthopedics, you name it, it covers it. And somehow, even though I failed obstetrics and gynecology clerkship rotation, I had to do remedial work. I passed all three of my final MBBS examinations first go. So it was a rough set of exams and a rough medical school career, but I passed one go. Thankful for that. Finished medical school, did my internship, and in my internship decided to do the MRCS examination. And during that time, I was ambitious. I wanted to prove myself. Now, in my internship, you're graded. At my first rotation in internal medicine, in pediatrics, sorry, I actually failed that rotation by 0.5, I think it was. Don't think I failed, but based on the assessment of the seniors, I failed the rotation. And mind you, the rotation has a high failure rate. So I said, okay, no problem. I had to do a remedial month. I did the remedial month, but I transferred from where I was, which was in Tobago, to Trinidad, and did my remedial month and got an 8 out of 10 in that rotation. All the other rotations I got 8, 9, 10 out of 10. So I did really well in the surgical rotations and internal medicine. So I did my internal medicine rotation in Port of Spain General Hospital with one of the leading consultants here in the Caribbean, Dr. Simongo. And I also did my rotation with Dr. Lala, who is another awesome consultant. These are great consultants in Trinidad and Tobago in internal medicine, and enjoyed my time there, and I did my remedial month at Mount Hope Hospital in which is like it's like north. It's along the east-west corridor. It's one of the leading hospitals there in Trinidad as well too. When I finished my remedial month, which was like August of 2014, I moved to Jamaica, and I started my rotations at University of the West Indies Hospital in orthopedics as an SHO. Let me tell you something. Orthopedics is a lot of fun. I love orthopedics. And when I told you I was going to go all out for it, I went all out for orthopedics. I would go to all the private cases. I would go to all the public cases. Like I was passionate. I'm passionate about surgery on a whole. So I was passionate about going and scrubbing in and you name it. My next rotation after that was primary care, and then I rotated through to cardiothoracic surgery, which was once again, the first time I saw beating heart was in Port of Spain General Hospital when I was a medical student, and then the second time I saw it was as a cardiothoracic SHO, which it was a lovely rotation. The consultants always are very polite and very facilitating. So at that point in time, I applied for the orthopedic program and I was successful. So it's July of 2015 I started my orthopedic rotation, and I got lovely recommendations from the consultants. The consultants were always facilitating, very helpful, and I'm passionate about surgery, so I was just happy about it. And somewhere along the line, I don't know what happened, but I just lost my way a bit, and the subsequent year, like within about 9-10 months of the because you rotate 3 months, I did orthopedics, then after that I did urology and gen surge. Orthopedics was really lovely, gen surge was cool. Urology was a bit rough. It wasn't pleasant for me, urology, but that's another story that I won't ever share, but still. And after about 9 months, I left the program. And I was lost. And let me tell you how lost I was. Like, I knew I wanted to do surgery, didn't know what I wanted to do where I wanted to do it, but I knew I wanted to do surgery. And I know I mentioned this in my other videos. I had an idea as a medical student that maybe oral and maxillofacial surgery was a really good specialty for me to do. And I went and I approached like Dr. Candy Narayan Singh, who's one of the leading oral maxillofacial surgeons in Trinidad, and she, awesome surgeon, very awesome surgeon, and she was like, if you're really serious about this, the examiners from abroad come down to do exams for the dental students in Trinidad, so come and meet them. And something happened, I didn't go in the end. I don't know if I didn't believe like I could do oral maxillofacial surgery. I don't know what it was, just didn't go. So in the end, I never spoke to her again from that, but I really should have gone, clearly. So, excuse this shirt, it's a bit rough, but whatever. In the end, I came to Jamaica and did orthopedics. And like I said, after I left the program, I was lost. And my mom said to me one day, well, Misha James, you did it MRCS Part A in 2014, you were unsuccessful, you missed it by like four marks, 4 grades, or 4 points. Why not repeat the exam? So that year, I took her advice and I set the MRCS Part A in September of 2016. Because I was in that time between 2016 when I left the exam and September, which would be in February of 2016 when I left the program, and September of 2016 I was working in primary care. So I decided to do the exam in September of 2016 and I passed. That's why you should listen to your mom. And the next year I decided to take the Part B, and you know that story already. I was successful in that part. But here's the funny thing. When I went up to do my exam, my intent was to actually migrate. My intent was to leave Jamaica and go to the UK and work as an orthopedic SHO and hopefully progress to a registrar. And I was content to be a registrar. But during that time, the thought of oral maxillofacial surgery came back to me, and I was just like, one night, I'll never forget it, like 3 o'clock in the night. I was here just before I left for the UK, the thought came, apply to dentistry, and I applied to dentistry, and I was successful. I actually did my interview for dentistry in the UK, in Bradford Hotel, via Skype, and I got in. And in the June I started, and it's been, and like literally that's how my journey, like how I ended up in dentistry now on a path to oral and maxillofacial surgery. And my path in dentistry has not been easy. And I'm not making excuses, but the things that you have to balance when you're in dentistry, along with a family, along with working, because I'm working in accident emergency, and I'm absolutely learning so many things. Like, it has to be divine intervention why I'm in accident and emergency, and I'm telling you why. I'm tired all the time. I'm frustrated, but the knowledge that I'm getting on a day-to-day basis, just working in accident and emergency. I work amongst some of the leading consultants in, like, University Hospital Destiny has the leading consultants in the Caribbean. Some of pretty much everybody there is at the top of their game, and they're awesome consultants. Don't get me wrong, they're awesome consultants throughout the Caribbean. But I'm just saying that the hospital is the flagship teaching hospital in the Caribbean. That's what I want you to understand. So when you're there, you're learning. You're always learning. You're always learning. And these are things you can't learn in primary care. When I was in primary care, which is what I was working doing, I still do primary care now. I work at a private office in Portmore. But even then, the things that you learn in primary care aren't as critical as what you learn in accidental emergency. So, sorry. It it I'm literally building all these necessary skills to be a great oral and maxillofacial surgery. The only thing I'm not practicing just yet is the hand skills, but that's coming. That's going to come in the labs that we're doing for endodontics, oral surgery, you name it. So, like I said, dentistry hasn't been easy. Um, just to stay motivated. Sometimes I'm just so tired, but even today I was tired and I was trying to read a bit of endodontics in between like patients, but they didn't really work out. But I just want to show you that the path isn't easy, nor is it short. But we're looking down the road, and I just showed you how long, like literally, this journey started from 2000, from the year 2000 when I was in first form to now, and I never got the grades that I wanted to get, but I got some grades and I'm thankful for those grades, and I'm on this journey. So the next step for me now is that I have about 9-10 courses this semester, and right now I'm about to study for endodontics, and I'm going to do a bit of exodontia or surgery as well too. And you understand my journey. I've been given a blessing where I've been allowed to work in a hospital, and that in itself is a blessing. And I'm working and studying 7 days a week, so I have no break, no nothing. But if you ask me if I wanted a break, I'll tell you no, because I'm on a journey, I'm on a path, and that's just the way it has to be for now. And if you compare this training to the UK, literally those that are in the UK pursuing their dental degree or their second degree, they have to work and study at the same time. So I can't complain. Like I have it made when you think about it. Not made perfect, but I mean it's a very nice setup. So for those who want to do oral and maxillofacial surgery, for those who want to do dentistry, for those who want to do dentistry and medicine to do oral and maxillofacial surgery, it's not a short road, but it's not a road where you're going to be encouraged by everybody, but there will be some persons who will be there to encourage you along the way, and there will be some persons who are there to discourage you, but you have to keep in mind that you want to be on this journey. So I just wanted you to understand how long this has been, and this journey has been, and to show you exactly why I'm so determined, even though today I wasn't feeling so good about this journey, because I was just feeling a little sad. You know, I know every now and again you have negative thoughts. You have to fight that. Just swat it away. So my name is Dr. Cisnet. I'm a medical doctor. I'm a member of the Royal College of Surgeons. I'm a fourth-year dental student, and I want you to continue pursuing your goals wholeheartedly.